you're looking to dive into topics on how to live a happier, healthier, more fit, and long lifespan, then you've come to the right podcast. Living the Dream with me, Coach Damian Evans. Together, we will explore the topics on all things health, fitness, and wellness. Together, we will be lifelong learners on this journey to living the ultimate dream. What up, Dream Team? Coach D here, coming at you from beautiful sunny San Diego, and welcome back to the Living the Dream podcast, where today we're going to cover the topic of training to help you reach for your health, fitness, and wellness goals, and in order to live your dream life. And today we're tackling a topic that most humans will face at least at some point in their life, and that is training with pain. Training with pain. Whether it's chronic low back pain or a tight shoulder or some cranky knees or just that lingering ache that pops up every time you do squats or reach overhead. Pain can be confusing. Pain can be frustrating. Pain can even be really scary. But here's the truth. Pain is not a stop sign. It's a signal. Pain is a signal. Today's episode is about helping you understand that pain is part of the process. It's not the end of it. We'll talk about why pain doesn't always mean damage. We'll talk about how to move through pain safely and how to use pain as a tool for progress, not a reason to give up. If you've listened to my episodes on my rules for life, you'll know that my rule number 2 is if you don't use it, you will lose it. One of my core philosophies, it's simple. If you don't use it, you will lose it. Pain often starts because we've stopped using something. Muscles weaken, joints stiffen, tissues become underloaded and deconditioned. Posture breaks down. And then one day we pick something up off the floor or we reach to grab a coffee mug or a backpack out of the back seat and boom, pain. But here's the deal. Completely stopping movement because something hurts, that is often the worst thing you can do. Avoidance leads to a couple of things. Avoidance leads to nervous system hypersensitivity. All that means is when you avoid a movement, the nervous system, your brain and spinal cord and your nerves, they can become more sensitive over time. This is called central sensitization. Your brain starts to interpret even small, safe inputs like bending over or walking upstairs as threats. And that turns mild discomfort into pain. And that turns the pain into fear. Avoidance also leads to fear of movement. Fear of movement. Once your brain associates pain with specific actions, you stop trusting your body. You start flinching at movements. You start guarding unnecessarily and restricting your range of motion, all of which reinforces the problem. Here's a story from my personal experience. A few years ago, 2020, right before the lockdowns, we were driving, and I actually think it was right after the lockdown. We might have not been supposed to have been driving, but anyway, we were at a stoplight, and this person came from behind us, and the sun was shining right in our faces, and I don't think that person could see us, that the stoplight had turned red, ran right into the back of us, and then we ran into the people in front of us. So it was like kind of like a boom boom type of thing. And I had my head down. I was in the passenger seat and I was looking at my phone, and I had hit either my head on the dashboard or I had bit my lip or something. I had started bleeding on my mouth. And ever since then, if I just barely knock the back of my head, for some reason, I get this huge like neurological just shooting pain in my neck. And it's because my body is guarding unnecessarily. My body remembers that traumatic experience. And It's like the craziest thing. Anytime like I turn my head too fast or I get scared by something, it's like my body wants to guard unnecessarily. You can create this association. This pain can be associated with a specific action, or an action can cause your body to associate it with a prior experience in pain. So this is not pseudoscience. This is not woo-woo. This is something that your body has. The body keeps score. Avoidance can also lead to loss of strength, mobility, and resilience. Muscle atrophies. Muscle can atrophy within days of disuse. If you've ever had a cast on your arm, you know that this is true. According to a study published in the Journal of Rehabilitation Medicine, muscle strength can decline by as much as 3 to 5% per day of strict immobilization. So when you have your muscle immobilized, it can decline as much as 3 to 5% per day. Over time, that weakness sets the stage for more pain and re-injury. And avoidance can also lead to greater risk of injury long term. When supporting muscles weaken, compensations kick in. The body shifts movement patterns, it loads joints unevenly, and it exposes tissues to forces that they're not prepared to handle. So if you're 40 years old, if you're 50, 60, and saying, well, I just can't do that anymore. I have people coming into the studio all the time saying, I can't squat because of my knees. I can't do deadlifts because of my back. Okay, well, imagine what your 90-year-old self would say. Would they thank you for giving up early? Or would they thank you for pushing through in a smart way, in a way that can get you doing that movement safely and properly, and slowly, progressively overloading that movement until you get back to strength? Pain does not equal damage. Pain does not equal damage. I have to say this so many times because a lot of people, they'll come in and they'll be like, I hurt my shoulder. And I'll be like, oh, okay, what happened? They'll be like, 12 years ago, I hurt my shoulder and I've just dealt with it every day since then. I'm like, that your body heals. Your body will heal itself. 12 years ago, you may have had damage. That pain is not coming from physical structural damage anymore. This is so critical to understand. Pain does not equal damage. Pain is a protective mechanism. It's your brain's way of warning you that something might be wrong. It's not proof that something is structurally damaged. According to pain science researchers like Lorimer, Moseley, you can have pain without injury, and you can have injury without pain. There are people right now with herniated discs on MRIs who have zero symptoms. And then there are other people with no structural damage to their discs who have chronic back pain. If we took an MRI of all of our spines right now, a majority of us, I would say a lot of us or most of us, would have some sort of degeneration of discs, or maybe even a herniated disc, or some sort of thing that might be considered, abnormal, but no pain. And a lot of us that have back pain that is coming from no structural issues at all. Pain is influenced by a multitude of things. Pain can be influenced by your stress, by your sleep or your lack of sleep. Pain can be influenced by your beliefs about injury, which is crazy. Your beliefs cause chemical cascades from your brain into your body. And your beliefs about injury can influence pain. Pain is influenced by past trauma, by your current emotional state. And yes, sometimes pain is influenced by tissue damage, but it's only one part of the equation. This is why movement, mindset, and education are such powerful tools in the recovery process. They change how the brain interprets signals. They reshape the narrative in our head. So the next time pain shows up, instead of asking, what's broken? Try asking, what is my body trying to tell me? What is my body trying to tell me? Let's talk about the anti-movement argument and why the anti-movement after an injury is flawed. Let's be fair. Some people, even well-meaning health professionals, they might say, just rest until you're 100% pain-free. Others might say, avoid anything that hurts. Just avoid anything that hurts. And you don't want to make it worse. And while all of that does sound logical, here's the counter argument. 1, rest rarely solves root causes. It might calm inflammation, but rest doesn't restore movement patterns. Rest doesn't rebuild strength, and rest doesn't address the faulty mechanics that caused the pain. Rest rarely solves the root causes. Number 2, total avoidance, it builds fear. The longer you go without using something, the more foreign it feels to you. And that unfamiliarity, it breeds uncertainty. And the brain doesn't like uncertainty, so it will respond with more pain. Total avoidance builds fear. And number 3, resilience requires exposure. We talked about this last week on last week's Training Tuesday episode of hormesis and of supercompensation. Resilience requires exposure. Your body gets stronger by being challenged. Controlled progressive movement helps desensitize the nervous system and to retrain the brain that movement is safe. Remember, movement is medicine when prescribed correctly. Let's talk about some real examples from the gym that I see. I see this every day in both my personal training clients and our group fitness members. Back pain, all the time I see it. We modify squats. We modify deadlifts. Maybe we elevate the heels so that their ankle mobility isn't really a factor. Maybe we add support. Maybe we shorten the range of motion. We don't go all the way down. But we don't stop squatting. We don't stop deadlifting. We don't stop because of the back pain. Shoulder pain. I did an entire shoulder mobility clinic because there were so many people talking about their shoulder pain. Maybe we take out the overhead press and we add an isometric overhead hold. So we teach our body that we can put our arm over our head and hold on to some weight. Maybe we work on scapular control because a lot of times shoulder pain comes from an improper alignment of the shoulder girdle. So the shoulder blades are not working properly with the arm bone and with the clavicle and all of those things that need to move in unison. They're not being recruited in the way that is optimal. So maybe we work on some exercises that help strengthen their scapular muscles. The shoulder blade and the shoulder loves blood flow. So maybe we just figure out a way to get some blood flow to the shoulder by doing exercises that pump some blood flow to the backside, like banded rear delt flies or banded rows. Or maybe we do an assisted dead hang where they can put a little bit of weight into their arms and they can just kind of hang there and show their body that they can put their body into this position. And eventually you start to load that up and eventually you start to add a little bit more movement to it, but we don't stop moving. Knee pain. Knee pain is another huge one. People struggle with reverse lunges. They struggle with step-ups. They struggle with wall sits or squats. We got to find the range that works for them and then build from there. A lot of time knee pain, the knee is the middleman and the actual issue is coming from the ankle or the hip. So we figure out how to strengthen the joints above and below the knee. We strengthen the muscles that support the knee. And eventually, after time invested and after consistency, we earn our way out of knee pain. But we don't stop bending the knee, because if you stop bending the knee now, think about when you're 90, you will be in a world of hurt. You will probably be in a wheelchair. You will probably have a lot of people that need to take care of you in order for you to just do the things you need to do on a daily basis. We don't stop moving. I see vertigo a lot, which is kind of one that you wouldn't think. A lot of people get vertigo. We slow things down. We anchor the person with breathing and we do balance work, but we stay consistent. We can't let that vertigo take over our entire lives. I see sedentary or postural pain all the time. So things like upper cross syndrome, which causes that hunchback look, that causes that forward rounding shrimp posture. So doing postural drills, doing band work to start to strengthen the backside, doing mobility circuits to work on the shoulders, the thoracic spine, which is the mid-back spine, the hips, the ankles, that kind of stuff. We rewire those patterns gradually, and we teach the body that I can get into this position. Now I strengthen and I can find control in this position. And then eventually we progress to get bigger, better, faster, stronger. We have to start at the foundation and build from there. When someone says, I have X pain, my response isn't to stop. My response should be, and your response should be, let's find the entry point. Let's find something that I can do. Let's find something that stimulates this movement that I'm looking to do in a way that I can recover from, that's not doing more damage. But that's the key. You have to meet yourself where you are now and progress from there. One of my favorite quotes from Ben Pakulski, famous bodybuilder, he does an awesome podcast. He has so much wisdom. He says, if I can't, I must. When there's things that happen in your day that you cannot do, that should be your first signal that is not what you need to work on the most. That is number one in your book. If you can't, you must, because if you can't now, you never will be able to ever again if you don't work on it. And if that's something you can live with, then that's something you can live with. But you need to be able to do these fundamental movements: squat, hip hinge, lunge, push, press, pull, walk, run, jog, jump, rotate. These are things that the human body was meant to do. These are things that the human body can do up until the day you die. These are things that most people lose because of rule number 2. If you don't use it, you will lose it. So here's how to train with pain safely and effectively. Here's the framework that I use and that I recommend. Number 1, you have to lead with empathy for yourself. Lead with empathy for yourself. You're not broken. Right now, you're adapting. Something happened in your past. Something happened to your body. Something happened. You're not broken, but you're adapting. And you're finding what you can do, and you're going to move from there. Number 2, assess, don't assume. Where is the pain? What triggers the pain? What makes it feel better? What's your movement history? You have to assess, don't assume. A lot of the times where you feel the pain is not the source of the pain. Number 3, find your minimum effective dose. What can you do today? What can you do today without flaring things up, without making things worse? You might have to go through a little discomfort. You might have to get uncomfortable, and it might not feel great. I had to rehab my patella tendon rupture. So your patella, it's actually a patella ligament because it connects bone to bone, but it's the ligament that connects your patella, your kneecap, to your lower leg bone. That snapped on me when I was going up for a dunk in college. That was a 9-month rehab injury, and I had my leg straight in a cast probably for 3-4 months. Can you imagine having a joint in a straightened position and then having to get it to bend all the way back to where it should be able to bend? That was so painful. It was excruciating. I had to go through that discomfort because I needed to be able to get my knee back to that position. And now, because of the way that I rehabbed it, the way that I was consistent, the way that I put a priority on making sure that I got better every single day, I can now run faster, jump higher, and lift heavier than I ever could. Find your minimum effective dose. What can you do today without making things worse, but you might have to experience a little discomfort? Number 4, use movement as medicine. Movement is medicine. Your body loves blood flow, and blood flow brings recovery. So gentle, progressive, consistent movement. Even massage helps to get blood flow to those areas, especially those areas like your joints that don't get a lot of blood flow. Tendons and ligaments, they don't have as good of a blood flow supply as muscles. So get some massage in there. Get some red light therapy. Get some E-stem, it's called E-stem, where it gives you little tiny electrical shocks that will help to activate that muscle without having to move the joint. The right movements here, done well, can reduce pain. Number 5, stack small wins. You have to build trust in your body again. You don't need to deadlift your body weight next week. You don't need to do 65 pull-ups. You just need to hinge. Learn how to hinge properly. Learn how to hang a little bit of weight into your arms. You just need to do a little bit. Stack small wins and get better and better every day. And number 6 is just like anything else. You have to stay consistent. Consistency over intensity, patience, patience, patience. Your body adapts over time. Give it the stimulus that it needs to adapt. Give it the opportunity to grow. Stimulate, rest, build, repeat. Stimulate, rest, build, repeat. So some actionable takeaways from today. Here's what you can do right now if you're dealing with pain. Do not stop all movement. Instead, identify what movements feel safe and doable and start there. Start small, but start. Modify, don't eliminate. Reduce range of motion if you have to. Slow down the tempo. Really decrease the weight and the load, but just keep moving. Work on adjacent joints and tissues. If you can't use the knee, work the ankle, work the hip. You can't overhead press? Start to strengthen your mid-back, your core, your wrists. Work adjacent joints and tissues and help that area that needs a little bit of recovery to be stronger. Use isometrics. This is a huge one. There are things called isometrics, which are just static holds. So things like a wall sit or technically a plank, things like a Pallof press. I love overhead holds or overhead carries. For knee pain, if you can hold a static lunge at the bottom of a lunge or a wall sit, there's just really, really good benefits in doing isometrics to reduce pain sensitivity while also helping to build strength. There's a 2021 study in the Journal of Sports Rehabilitation found that isometrics, they can be super effective for tendinopathy and joint pain. So tendinopathy is pain in the tendon and joint pain is pain in the joint. Isometrics are really, really good for these type of pains. Also incorporate breath work, long, slow exhales. Long, slow exhales. This reduces sympathetic tone. It puts you into a more rest and repair state, and it helps to calm your nervous system. So if your pain is coming from an overactive nervous system, focus on long, slow exhales. Incorporate breath work. This can reduce pain perception. You can also keep a pain journal. Track what movements hurt. Track what helps. And then track how your pain responds to stress and sleep and training. The more you can track it, the more you can manage it, the more you can see trends over time. A lot of things that you'll miss if you don't write this down. And lastly, talk to someone who understands the movement. Don't settle for just rest. If your doctor, chiropractor, anyone says just rest, and it's been over a couple of weeks since your injury, depending on the severity of the injury, don't settle for the answer, just rest. You're being dismissed if that's the case. Find a coach or a therapist who can work with your body, not avoid movements. You cannot avoid movement. You have to keep moving. Remember, you are training for your future self. This is about more than just fixing an ache. It's about protecting your future. Because if you stop moving now at 30 or 40 or 50 years old, where is that going to lead? Your 90-year-old self is watching you right now. Are you making decisions today that the future you will thank you for? Train smart, train aware, and train consistently. And trust that your body is strong. It is resilient. It is anti-fragile. Trust that your body is built to adapt, not just survive, but to thrive. Movement is life. Motion is lotion. Fitness is medicine. And your body is worth fighting for. And that's it, my friends. Thank you so much for joining me on this Training Tuesday episode of the Living the Dream podcast. Please share the knowledge that you gain with your friends and family and hold each other accountable. If this episode inspired you, share it with a friend who may be experiencing pain. To support this podcast and help it grow, please subscribe on whatever platform you're listening to this podcast on and leave a review telling others how this podcast benefited you. Leave a comment on this episode letting me know how you're incorporating this movement instead of avoiding pain. This is a really non-cost way to help get this important wellness content into more people's ears. Tag me at livingthedream_podcast or at coachdamian_SD and let us know how this episode benefited you. Let us know what we missed. Let us know what we got wrong. We want to know. Message us if you have any suggestions or tips that would help your Living the Dream team that we can discuss in future episodes. I will be right here with you working on making us stronger, happier, and healthier humans. Until next time, friends, keep living the dream.